Hello, so my name is Hunter Harbold. I'm a field paramedic with the Parker County Hospital District, LifeCare EMS. This is our kind of attempt at the COVID-19 Stop the Bleed course. So we will do the lecture today here online, and then you will have your skills checked off in person. My email address will be in the description of this video. If you have any questions, feel free to reach out. The good thing about this course is that you may have learned about tourniquets or bleeding control in the past. Just realize today that this course is not a matter of my opinion. What happened was the Hartford Consensus, the American College of Surgeons, TCCC, and NAEMT got together with a large pile of federal money and created bleedingcontrol.org, or the Stop the Bleed program. This actually happened right after Sandy Hook. What they found is after Sandy Hook is a lot of those patients that died had the right training and equipment been there, a lot of those students would have lived because they were hit in extremities, which is easily treatable with a tourniquet or direct pressure. So that kind of prompted this program to become more popular. All of your districts within Parker County have Stop the Bleed equipment. Reach out to your administrator or school nurse for the exact location of those, but they are red backpacks with 5 individual Stop the Bleed kits, and each campus should have 10 kits. So reach out to your school nurse to familiarize yourself with where those are at within your respective campuses. This class is required for new staff. House Bill 496, which was passed the last legislative session, requires all school staff to be trained in this. So some of the images are graphic. Normally I tell people they can look down or walk out, but I guess in this case you would just skip past it or whatever you want to do. But I promise it's nothing worse than an R-rated movie. It's really not too bad. So just a warning on that. So when I think of Stop the Bleed, I always think of like Aurora, Columbine, Sandy Hook, those examples, Sutherland Springs, those examples, but it's really so much more than that. The last time I put on a tourniquet was actually a dog bite. A guy got bit by a couple pit bulls on his legs. The time before that, it was a dialysis fistula where they joined an artery and a vein in your arm for dialysis, had actually opened up inside the post office, and the patient was bleeding quite a bit. But realize that it's more than just mass shootings, bombings, stabbings, and those things. It's also motor vehicle collisions, football injuries, cafeteria injuries, classroom injuries, fighting, assaults, whatever. It is so much more than just mass shootings. So make sure, don't get too dialed into that. You'll see a lot of this stuff references gunshot wounds, but it's a lot more than that. All right, so you'll notice most things in healthcare use an algorithm, and for Stop the Bleed, it's ABC, which is alert, call 911, B, find the bleeding injury, and then C, compress. So within this course, you'll be checked off on your campus on these 3 skills, which is direct pressure, applying a tourniquet, and wound packing. So you'll actually do all 3 of those, and all 3 of those tools will be in our toolbox at the end of this lecture. All right, so safety. Safety really is number 1. There's a reason this was at the beginning of the presentation, because before you offer any help, you must remain safe. If you become injured, you will not be able to help the victim, and you should only initiate care if the scene is safe to do so. So if you're inside a cafeteria and there's an active threat, that is not the time to start treating patients. We would stop the threat or retreat to safety and then start treating patients. Just realize sometimes we see this snowball effect where you start treating patients and then you become injured, and then someone treats you and then they become injured, and we just see this exponential growth in harm in patients. So just realize we only initiate care when it's safe to do so. And if any time your safety is threatened, you need to attempt to remove yourself from danger and retreat to a safe place. So protect yourself from bloodborne infections by wearing gloves when available. So the Stop the Bleed kits that we purchased for y'all do have gloves in them. However, contrary to popular belief, if you were to look at your hands, they are sealed and waterproof, with the exception of that unless you have an open or festering wound. So just realize that best practice, we should always wear gloves. But they want me to tell you that most of the time you're going to be okay to proceed without gloves. However, proceed at your own risk with that. There is a risk, but once again, not a matter of my opinion. They want me to share that with you. So A, call 911 yourself or tell someone to call 911. I always use the perfect example. If we're inside the cafeteria and someone says, hey, go get the principal, everyone else assumes that everyone else is going to get the principal. So we really need to be assigning these tasks to say, you in the blue shirt, go get this principal. You, call 911. You in the yellow shirt, go get the stop the bleed kit, and assign these tasks to people. Because what we tend to see is when we assign a task or we just yell out a task in a large group is that everyone else assumes everyone else is doing it. We don't want that. So make sure that we're assigning those tasks. Because we know in 911, on our very best days, it's going to be 2 to 3 minutes from the time you pick up the phone to the time the wheels of a fire truck or ambulance start rolling towards you. And that's during the day on a good day. So realize it takes a while to activate the 911 system. So just make sure that we alert 911 early, and that doesn't get forgot. Sometimes in the heat of the moment too, everyone assumes that everyone else did it and it hasn't been done. So B, we're gonna find where the victim is bleeding from. This can be a little bit difficult. Blood tends to be like motor oil. A little bit of blood or motor oil on the ground looks like a whole lot. It's red, it's scary, it's intimidating, it's foreign. So just realize that blood smears, and it can be very slippery. And Hollywood has always told us that gunshot wounds look like this, right? A very large, grotesque, gruesome wound. And that's really not the case always. Sometimes they can be smaller than the size of your pinky. They can be very small wounds depending on the round and what happened. So just realize that it doesn't always look like that, and it can be very difficult when someone's bleeding, and especially under stress, to find where someone's bleeding from. So we can open or remove the clothing to see where they're bleeding from. Inside your stop the bleed kits, there's something called trauma shears, which is a pair of medical scissors that can cut through belts, leather, boots, jeans, jackets, whatever. It's extremely sharp to remove someone's clothing. In EMS, it's a term I don't really care for, but it sticks with people, is the term trauma naked, to where if someone has trauma, we'll remove all their clothing to try to find their injuries. And the trauma shears will certainly help with that, and those are in your stop the bleed kits. But today we're actually going to focus on these, right? Life-threatening bleeding. That's the purpose of this program. We're not focusing on nosebleeds or paper cuts. We're focusing on life-threatening bleeding. So life-threatening bleeding, I'm going to read these off word for word, is blood that is spurting out of the wound, blood that won't stop coming out of the wound, blood that is pooling on the ground, clothing that is soaked with blood, bandages that are soaked with blood, loss of all or part of an arm or a leg, so a partial or full amputation, or bleeding in a victim who is now confused or unconscious. That would be bad. That would be, shock or imminent cardiac arrest. So these are life-threatening bleeding, and I think that can be a little confusing to an educator or a teacher or someone not trained in medicine. So simply put, if you walk in a room and you're like, wow, that's a lot of blood, or man, I'm glad that's not me, yes, it is life-threatening bleeding. So we would rather you be aggressive with these patients than be a little bit more timid. So lean on the aggressive side of treating these patients, because they have better outcomes when we're a little bit more aggressive with our treatment. So here's an example. This is a cadaver. It's a body that's been dedicated to medical research, and they're pumping blood through there to simulate an arterial wound. And something that I always ask my classes is, how long do you think until this patient dies? Like their heart just stops? And I think the answer really varies. I'm going to say anywhere between 3 and 6 minutes, which isn't a long period of time. But I think a better question is, how long until you think they lose the ability to cognitively think and apply their own tourniquet or control their classroom or fight or get help? That's probably closer to 30 seconds to a minute. You're not going to have a long time to cognitively think when you're bleeding out like that. And of course, that would be life-threatening bleeding. And when people see this one, I ask, is this life-threatening bleeding? And a lot of times I get mixed results, but the answer is yes, this is life-threatening bleeding. I would not want my leg to look like this. And there you can see the clothing around the wound is soaked with blood. So yes, that is definitely life-threatening bleeding. None of us would want our leg to look like that. And then I always ask the question with this one, is that life-threatening bleeding? Once again, the clothing around the around the wound is soaked with blood. So yes, that's definitely life-threatening bleeding. And I would not want my foot to look like that. But arm and leg wounds is what we're going to talk about, because arm and leg wounds are the most frequent cause of preventable death from injury. And that goes back to the Sandy Hook thing. We can really easily treat these patients very quickly, very effectively with tourniquets and or direct pressure. So their death is very, very preventable because we can treat them very effectively. So we treat arm and leg wounds with direct pressure and or a tourniquet. And then we have our torso junctional wounds. That's going to be your neck, shoulder, and groin. This type of bleeding can be stopped with direct pressure and or wound packing. So we can use either one of those, and we'll cover exactly what those are in just a minute. You can't put a tourniquet on someone's shoulder, and of course you shouldn't put it on someone's neck. You also can't put it on someone's groin. All right, so chest and abdominal injuries. So this is your front, back, or side. This will usually cause internal bleeding. Bullets cause a phenomenon known as cavitation. When they go into something or someone, they create a cone-like shape with their energy, and everything slams back together, and that's what causes their devastation, and that's known as cavitation. So it will cause massive internal injury when a bullet or something at a high speed hits someone. But this bleeding cannot be stopped outside of the hospital. It doesn't matter if you're a paramedic, a doctor, or a nurse, you cannot stop this bleeding outside of the hospital. So the best thing we can do is rapidly transport these patients to a trauma center. Our trauma centers here in Parker County, the closest ones, would be Harris Downtown and John Peter Smith, which are about 20 to 25 minutes from here in Weatherford. The best thing we can do is identify these patients to EMS providers when they arrive. So if someone's been hit in the abdomen and someone's been hit in the hand, of course the one in the abdomen, their best hope is to get to the hospital as quick as possible, so they should go to the hospital first. It's morbid, but sometimes we have to ask ourselves who's going to die first from their wounds, and that's who we need to take care of first. I like to point out this picture over here. These are multiple gunshot wounds, and once again, it's not what Hollywood told us they're supposed to look like. These are pretty small wounds. There's not a lot of blood. Just know that sometimes with abdominal and chest and back wounds, people tend to bleed in. Not always, but they can bleed into their abdomen pretty effectively. So inside the presentation, it kind of stops there. But if someone's hit in the abdomen or chest, we can cover, especially their abdomen or back, we can just cover it with a gauze or a shirt or whatever we have and just cover the wound. That's probably going to be the best thing we can do. We don't apply direct pressure, we don't wound pack, we don't do anything like that in the abdomen. You're simply just displacing organs and not really packing up against anything. So once again, we do not do wound packing inside of the abdomen, chest, or back. So we go through this algorithm and it says ensure your safety, look for life-threatening bleeding. Is a trauma first aid kit available? No. So we're going to use any clean cloth or gauze, and we're going to apply steady pressure directly to the wound. And the presentation over and over again will say the word clean cloth or gauze. And if you don't have a stop the bleed kit, some things that we could use other than this is a shirt or some pants or a jacket or a scarf or whatever you have. Just realize that work should be the cleaner the better. Don't think that I worked out this morning and my shirt's a little sweaty, so I shouldn't use that. That's really not the case. Just think the cleaner the better. So let's talk about direct pressure. So with direct pressure, you're going to use 2 hands or fingers. If at all possible, you should be using 2 hands. I'll show you what that looks like. And we know from our life experience that direct pressure is effective most of the time to control major hemorrhage. Even major arterial hemorrhage, like the guy that was shooting blood out of his shoulder in that video, direct pressure can be effective for that. And direct pressure requires very firm, continuous pressure until relieved by medical responders. And to be effective, when we apply direct pressure, it needs to be done on a firm surface. So that's not on a bed or the driver's seat of a vehicle if we can help it. We want that to be on a firm surface. And don't release pressure to check the wound. So they show this, this algorithm. Basically what they're trying to say here is that if it's a large wound, you could try to stuff some of the gauze or whatever into the wound to try to control the bleeding. So you're going to apply continuous pressure with both hands on top of the bleeding wound, and you're going to push down as hard as you can. You're going to hold pressure until relieved by medical responders. So let's say this is my wound and I'm doing direct pressure. That's like this. You take your hands, lock it out like we're going to do CPR, and we're pushing on it. And we're pushing pretty hard. I'm putting most of my weight onto this. But notice my elbows are locked out. You don't want your elbows like this because you can't do that for very long. But I could be like here, be in this position for a very long period of time, and it's fairly comfortable. So remember, direct pressure, lots of pressure, elbows locked out, leaning with our upper body. So we go through the same algorithm, but where's the wound? It's in the arm or leg. Is a tourniquet immediately available? Yes, great. So we're going to apply the tourniquet above the bleeding site, and we're going to tighten it until the bleeding stops. This program's called Stop the Bleed, not Slow the Bleed. So we're going to tighten the tourniquet until the bleeding completely stops. And here's a really great example of a tourniquet. So this guy has a very large hole in his arm, and they applied this tourniquet. And it's essentially like pushing down with your foot extremely hard on a water hose. We're taking the water hose and just kinking it to where nothing can come out that side of the water hose. And basically, if applied correctly, the tourniquet will stop the blood flow into the extremity and out of the wound. So it limits blood loss. And limiting blood loss may prevent the patient from going into shock or dying. And just a quick thought on that. So a standard water bottle is about 500 milliliters. We have depends who you ask, 8 to 10 of those in our body as an adult. If I lose one of those and you lose 4 of those, who do you think is going to have a better outcome? Of course, the guy that keeps the most amount of his blood in his body is going to have a better outcome. So that's why we tend to be a little bit aggressive with bleeding control, because we want people to keep blood in their body. They have better outcomes. So tourniquet application, we're going to apply the tourniquet immediately if life-threatening bleeding is seen from an arm or a leg. So what we used to do, and this was not what we do anymore, is we would do direct pressure, and then we would do pressure points, and then we would elevate it, and then we'd put on a tourniquet. And people were right. By the time we put on a tourniquet, most of the time the bleeding had stopped because they had died. We had waited too long. It took 4, 5, 6 minutes to work, through that algorithm, and we waited too long. So when we see life-threatening bleeding from the arm or a leg, we jump on those patients and we apply a tourniquet. The tourniquet can be placed right on top of clothing. The only exception to that would be like a thick winter coat. And you're going to place it 2 to 3 inches above the bleeding wound, but we do not apply it to the knee or the elbow joints. You cannot compress those, and you don't want to apply it over a pocket with bulky items. It won't be able to compress it tight enough. So an example of the 2 to 3 inches, let's say I have an injury here, 2 to 3 inches, just 2 to 3 fingers. So I could put a tourniquet here, here, here. Remember, we don't do it over joints, here, here, or here. But there's this idea that came out of the military, which I think makes it really easy and kind of takes the stress out of it, called high and tight with tourniquets. So you could just put a tourniquet up here, put it pretty high, and just get it as tight as you can get it, and then you're good. That whole arm's cut off. So just think high and tight if you're under stress. We can just put a tourniquet up here or pretty high up on the leg, and high and tight. So there's several tourniquets out here on the market. The ones inside your Stop the Bleed kits on your campus are called CAT tourniquets, or combat application tourniquets. They're very effective. They're fairly expensive, $30 to $35 a piece. But just realize you get what you pay for. You can get burned pretty easily by buying counterfeit tourniquets. They will end up failing. And I don't recommend that. I've heard countless stories of people buying fake tourniquets and they end up getting burned and they don't work the way they're supposed to. So there's other tourniquets out there like Soft T and Rat and all these different tourniquets, but just realize that we use, and the military uses, and most law enforcement uses, a combat application tourniquet. They're a great device with tons of research and data to support how great they are. So we're going to talk about the anatomy of the CAT tourniquet. So right here, I don't know if y'all can see this on the video, there's an elastic band within this plastic rod. And no matter which way you turn that rod, there's that elastic band will get tighter. So it doesn't matter if you go clockwise or counterclockwise, and that's what actually does the tightening. And what you do is you tighten it, and you get it as tight as it can go, or until the bleeding stops, and then you place it into this windlass clip. It's a little plastic clip, and this little white thing right here, the windlass strap, has the word time written on it, and you'll put that over it, and then you can write the time. The Stop the Bleed kits that we gave you do have a Sharpie for that purpose. So we'd like to put the time if available in there. So instead of going through this, I think it's a little easier for me just to show you how to apply a CAT tourniquet. So this is a new one, a brand new one. This is a one-handed tool because you may not have both hands to apply this. So this is called the red tip. I kind of tell students to think of this as like an arrow, and you want to pull it away from you. So you just take it and just pull it. And at this point, this tourniquet is pretty tight. But a few things to consider. My arm is straight. If my arm is curled up, it gets larger. Same thing with my leg. If I bring my leg up, like if I'm in a sitting position, my leg gets larger. So make sure that the extremity is straight. So my arm's straight. I just tighten the Velcro around as tight as I can get it. It's fairly uncomfortable at this point. So the next step is I'm going to turn the windlass rod. And for me, it just takes one turn. For you, it may take 2, 3, 4, 5, 6. You remember, we're going to turn it as tight as we can get it or until the bleeding stops. There's really not a worry about making it too tight in this life-threatening emergency. So it's tight at this point. The next thing I'm going to do is take the strap, and it's going to go through the windlass clip, and we're going to take the time band and put it over that. What that does is it makes it a little bit more difficult for the tourniquet to get ripped off if you're dragging someone or moving someone. So at this point, the tourniquet's extremely tight. And I don't know if you can see in the video, but my hand's starting to turn purple because that water hose has been stepped on, and now there's no more blood coming this way into my arm. So it's extremely tight. So now I'm just going to take it off. And you can also apply this to your leg. It'll be up to your administrator and whoever's checking you off with where you apply this. I recommend putting it up high on your arm more than on your wrist when in training, because if you put it on your wrist, it can hurt a little bit. But make sure when we're applying that Velcro the first time that you remove all the slack. That's a common mistake. You want to get it as tight as you can get it. So every step of the way, think tight, tight, tight. You want it to be tight. Here's some things that we need to talk about with tourniquets. When using one of the recommended tourniquets, it's a safe procedure, but using an improvised homemade tourniquet is far less effective, and we should not be using homemade, MacGyvered, belt, purse tourniquets, or whatever you've come up with. Chances are you haven't trained on that, or if you don't train on it often, and it's just not effective. So once again, not a matter of my opinion. Research is saying don't use an improvised homemade tourniquet. Only use a commercially available tourniquet. With that being said, I'm going to start saying it over and over again in this presentation. When you don't have a tourniquet, become really good at direct pressure. It works really well. And if the bleeding is not stopped with one tourniquet, as tight as you can get it, you can place a second one just above it as previously described. So let's say I have an injury here. You could put a tourniquet here and here. So you could put two tourniquets, or put a tourniquet here and here. You can put two tourniquets on the injured extremity if bleeding doesn't stop with the first one. Now, with that said, if you apply a tourniquet and you apply a second tourniquet and they're still bleeding, 10 out of 10 times your tourniquet is too loose. You need to go back and tighten your tourniquets because they're too loose. That's the problem. This is my favorite slide in the entire presentation. No amputations have been caused by a tourniquet when left in place for fewer than 2 hours. I'll say that again because it's really important. No amputations have been caused by a tourniquet when left in place for fewer than 2 hours. But it's best to get the patient to a trauma center as soon as possible so the bleeding can be definitively stopped. Yes, absolutely. But just know, I just told you we're 20 to 25 minutes from a trauma center. That's why we put tourniquets on patients, because the risk versus reward is far greater to go ahead and put on a tourniquet. So it's better to risk damage to an arm or a leg than to bleed to death. I completely agree. I had a student tell me once, I'd rather be a living amputee than die, and I completely agree. These training practice tourniquets should not be used in a real patient incident. These have trained around 25 to 3,000 people, 2,500 to 3,000 people. So you don't want to be using our training tourniquets. So tourniquet pain. So when you do this on your campus, you're going to see that tourniquets do hurt. They hurt quite a bit. Just realize that pain does not mean that we put them on wrong, and pain does not mean that we should take the tourniquet off. The best thing we can do is explain this fact to the victim and say, hey, I'm going to have to put on this tourniquet. It's going to hurt a lot, but I really think you need it to save your life. And put on the tourniquet and make sure that it stays on. So same with direct pressure or wound packing. I imagine that would hurt incredibly bad, but we can just explain that fact to the victim and say, hey, this is going to hurt, but this is what we need to do to help you. Once the paramedics arrive, we can treat them with pain medication if appropriate. So these are common mistakes, and I think that this slide's worded kind of funny, so I have to add the word common mistake. So it's a common mistake not using a tourniquet or waiting too long to apply it when there's life-threatening bleeding. It is a common mistake not making the tourniquet tight enough to stop the bleeding. It is a common mistake not using a second tourniquet when needed. It is a common mistake periodically loosening the tourniquet to allow blood flow to the injured extremity. There used to be this idea of like rotating tourniquets where you would kind of open up the water hose to allow blood flow back in and then close it back off. The problem is that causes unacceptable blood loss, and I told you blood's slippery, so sometimes people don't always get the tourniquet back on tight. So we don't do that. Set it and forget it. Once you set a tourniquet, it doesn't come off. And it's a common mistake removing a tourniquet. So we should never remove tourniquets, and that's in this presentation over and over again for a reason. So let's say you have a very small wound to your hand, but it's an arterial injury, and you're bleeding a lot, life-threatening bleeding. You put on your tourniquet, do a good job, and then you see, wow, that's just a really small wound. Maybe I overreacted. Maybe I didn't need that tourniquet. Don't remove it. Let a physician make that decision, because by the time you get on a tourniquet, the bleeding should stop and things shouldn't look as bad as they once did. So don't take off a tourniquet ever. If you have questions about tourniquets, feel free to email me. Leave your name, number, email me your questions, and I'll call you back. All right. So we go through the same algorithm, and I think this one's a little bit confusing, so I'm gonna just paraphrase this. Basically what it says is if someone's hit in the neck, shoulder, groin, or if you don't have a tourniquet available, we become really good at direct pressure, or we can do wound packing. So let's talk about these things called hemostatic dressings. The Stop the Bleed kits we bought y'all do not have hemostatic dressings for several reasons, but this is gauze that's embedded with material that speeds up the rate of clotting. So they do work pretty well. There's different brands, Quick Clot, Cell Locks, and like I said, this is gauze with chemicals that speed up clotting, but there's problems with them. The first one is they're fairly expensive and they expire fairly quickly. So just so you know, the kits that we have purchased for y'all on a grant do not have that material in them. So let's talk about wound packing. It's one of the last skills. So with wound packing, you're going to open the clothing around the wound, and if possible, you're going to remove excess pooled blood while preserving any clots that are already formed. Blood clots tend to look like a dark raspberry gelatinous substance. It's a dark substance. That's a clot. That's a scab. Leave it alone. That's what we're working so hard for. So you want to leave that on the patient. Don't remove that. And then we're going to locate the source of the most active bleeding. So kind of like what we talked about earlier, if someone's been shot in the hand and someone's been shot in the femoral artery, which one's going to kill them first? Probably the femoral artery. So we need to take care of that patient first, or that wound first. So always think, what's going to kill them first? Where are they bleeding the most from? I need to take care of that first. So you can pack the wound with a hemostatic dressing, or gauze, or a clean cloth, or a jacket, or a shirt, or whatever you have to stop the bleeding. But you're going to stuff right into the wound and directly onto the bleeding site. And that's what this looks like. You can see in here, they're quite literally stuffing it into the wound. This is not what we're talking about. This is a poor attempt at direct pressure. I didn't teach y'all to do direct pressure like this. You're quite literally wound packing. So if initial packing and direct pressure fail to stop the bleeding, you're going to pack a second gauze on top of the first. So same thing with direct pressure. Let's say that this is our wound, and I start doing wound packing. And how we do that is we just take our finger and you insert it in the wound and you keep packing, and you keep packing, and you keep packing until you can't get any more. And notice I'm not taking my fingers out, because if I take my fingers out, blood can pool up from underneath there and push your gauze out. So you got to keep some pressure on this, and you can use your thumbs if that's more comfortable. And we're going to get as much as we can in there, and then you're going to show us direct pressure. But let's say this becomes completely saturated with blood. What we don't want to do is be like, oh, let's restart. Let's just restart everything. You don't want that, because up underneath here is a clot. This is the beginning of a clot. And every time we take this off and restart, we lose that clot. So if this becomes saturated with blood, we just take more stuff and we put it on top. And if that becomes saturated, we put more stuff and we put it on top, and we put it on top. Because up underneath here against the skin is where a clot's forming, and we don't want to lose that. If you have questions about wound packing and direct pressure, let me know, or whoever's checking you off. But we'll definitely go over these in person when you're checked off on these. So let's talk about bleeding control in children. This is really important for educators. So in all but extremely young children or a small child, the same tourniquet used for adults, this tourniquet, can be used in children. The only exception for that is someone that's truly too small. We're talking very young. I always tell this story. It's really quick. There was this guy that was going to stab his mother, or his child's mother, and he missed and ended up stabbing his own daughter in her brachial artery. So it caused life-threatening bleeding. And he actually did this in front of police officers, so it's caught on badge cam. So they take him down, they rush the child outside, and long story short, this police officer applies a tourniquet to this very young 16-month-old child and stops the bleeding. And it was a really good video because it showed a police officer, no doubt, saving that child's life, but it shows that a tourniquet used for adults can be used on small children. Now, in a case where a tourniquet truly is too big, we're talking a really small child, like an infant or a very small child, direct pressure is previously described will work in virtually all cases. And just really think about that. With a 10-month-old child, how much pressure could you apply to their arm or leg? Of course, it's going to be enough to stop the bleeding. But for wound packing is the same for a 2-year-old as it is for a 26 or an 86-year-old. It's all the same. So wound packing doesn't change for an infant or an adult. Nothing changes. So let's talk about blood exposure. So after arrival of medical responders, if you've been exposed to blood, you need to wash your hands with warm water and soap, and you need to notify the medical responders. I tell you 2 laws to help empower you to react and act in these situations. The first one's called the Ryan White Act. And what it does is if you're exposed to someone's blood for whatever reason, whether you're a paramedic, nurse, teacher, physician, librarian, you have the right to know what's in their blood. And basically the hospital will draw their blood. It's a no-nonsense, no warrant, just a little bit of paperwork act. They draw their blood, and pretty quickly they're going to tell you what's inside that patient's blood that you were exposed to, and then try to start getting you the care and resources you need for that exposure. So that's why it's important to notify of possible exposure. And the other law is the Good Samaritan Act. So the Good Samaritan Act in Texas says if you provide care for someone without compensation, meaning you're not like being paid to be a nurse or a paramedic, but so as an educator, you're not being compensated to provide medical care. So if you provide care for someone in good faith, without negligence, they cannot come back and sue you civilly for any reason. So let's say you put a tourniquet on someone, they can't come back and say, I'm going to civilly sue you. So you are pretty well protected in Texas from that. Now the exception to that is if you do something outside your scope, like do something crazy, like try to perform a surgical airway or something like that. I'm not training you how to do that today, and that is not okay. So just realize if you act in good faith, the Heimlich, CPR, a tourniquet, those things, they cannot come back and civilly sue you. So this is the summary. We're done. So remember, we call 911. It can take a while. The quicker we activate the 911 system, the better. We're going to find the bleeding injury, and then we're going to apply pressure. We can do direct pressure and or use a tourniquet and or use wound packing. So just realize you can use multiple tools in your toolbox to stop the bleeding. Let's say you apply a tourniquet. You're not wrong to apply a tourniquet and then maybe wrap up their wrist if that's where the bleeding's from. Do whatever you have to do to stop the bleeding. You have multiple tools in your toolbox at this point. And this last one's cheesy, but it's true. The only thing more tragic than a death is a death that could have been prevented, and I absolutely agree with that. So, like I said, you'll be checked off on your campus. If you have any questions, like I said, my email will be in the description. Feel free to email me. I'd be glad to answer any questions, clarify on anything. I appreciate your time, and thank you for watching.